So far, it was largely the philosophers who studied human consciousness, but a serious effort to understand consciousness and walk the path towards ultimate reality was made at the MIT World Peace University in the form of the world's first conference on consciousness, the ultimate reality. Many eminent personalities, speakers, thinkers, and philosophers from all over the world share their thoughts on this subject during this conference. The second session was based on matter, mind, spirit, and consciousness. Experienced psychiatrist Dr K.Raghu made an interesting presentation on mind and consciousness.
Just salutations to all our gurus and the divine being, and also for the organizers here for giving an opportunity to make this presentation today. So the topic that I've been asked to cover today is on mind and consciousness. So I just want to kind of give you an introduction why we chose this particular topic and what is it that we are actually trying to present. Now we do read a lot of things about consciousness from the metaphysical perspective, and then few attempts have been made on and off to bring this metaphysical concept of the consciousness into something of a use in daily life. Now I've been trained as a psychiatrist from Nimans, and I've been practicing meditation for the last nearly 25-30 years. A particular type of meditation called as heartfulness meditation. So this idea came about in 2014. Why not use meditation as a part of treatment for various mental health disorders? So in our system there is the concept of different trainers. So we call an individual to our place, sit with them, give them a half an hour of meditation session. This is how the system works. During the course of that particular sitting, when we do that with a patient or any individual, what we see is that over a period of time, they actually change in terms of their approach to life, their way of life. All those things started to be seen to be changing. So this was quite interesting. And when I actually read about the literature from our own mission, mental illness there, the broadest definition of mental illness was defined as a imbalanced state of mind, and a normal state of mind or a balanced state of mind is what was called as mental health or normal mental health. So if that is the case, a imbalanced state of mind can be brought into a more balanced state by using this technique of meditation. This was the first inkling. Now we have been continuing with this approach over the last 8 years. And with that approach, what we have seen is that most of the patients who have been treated with this meditation would require small dose of medication and would also require a shorter duration of treatment. So this was very, very interesting for us, and then we just continued with this particular process, and then now we have applied it to almost all the range of the mental illnesses, the whole range. So when we applied this, except for this particular category of patients, we have applied it to almost every other category, including schizophrenia, anxiety disorders, depression, bipolar disorder, almost every other case. So with this background, I will be presenting this particular topic to just highlight what happens if a person meditates regularly. Now I am not going to dwell into the many different types of meditation. There are nearly 250 types of meditation. So each one works differently, each one works at a different level. People combine everything, yoga, pranayama, meditation, everything as one bunch. No, you need to look at each of these things as a separate thing, because each of them work on a different kosha altogether. So with this background, I will start the presentation. So I covered this, the components of the mind. Normally, if you just look at the metaphysical literature, they talk about manas, buddhi, chitta, ahankar as the four aspects of the antakarana. But when we practice psychiatry, what we see is that we also see disorders of other aspects of the mind, which is the kalpana, bhavana, prajna, and Icha Shakti. Now there is a big debate going on whether the prajna is part of the mind or it is something different from the mind. But irrespective of the semantics, can we use it on a day-to-day basis for the empowerment of the patient? That's the whole point of discussion today. What happens? There are many things that changes during the course of the meditation. One of the things that we see as people regularly meditate is that the amount of thoughts and emotions, they get refined over a period of time. So the thought burden comes down, the emotions gradually convert into feeling, then the buddhi, which is like more materialistic, gradually develops a discriminating quality. We call it as a viveka. So from buddhi you proceed on to viveka. Then there is a refinement of the imagination to the extent that as you go more nearer to the reality, what happens is that the imagination almost goes away, because imagination and reality cannot go together. Then the chitta, which is the, if you want to just look at it as consciousness, the consciousness gradually gets refined. Now refined of what? Refined of all the samskaras which are deposited in the consciousness. Now what we do during the process of the meditation is that we go on cleaning the consciousness of all the impressions that has been formed, whether it's in this life or any other life. But once it is cleaned, the person gradually moves from a conditioned state of mind into an unconditional state of mind. Now, when the person moves into an unconditioned state of mind, that is what we call as a yogic mind, where the person has full sense of creativity. A materialistic person is under the control of the three gunas of nature. A yogic mind can control these three gunas. So, this is the difference that you progress as you progress to higher realms of consciousness. Then the ahankar gets refined. Now there is, in our literature, when you read the metaphysical aspect of it, you just say presence of I or absence of I. But it doesn't occur in one stage. It's a very gradual process. In our system, we talk about 11 stages in which the ego gets refined. And the last one, as and when the ego gets refined, the willpower becomes heightened. Gradually, it multiplies it into a power called as divine will, where whatever that person wills will happen automatically.